Be a hero, save a life. Putting a face on leukemia and how you can help. I'm Kristina Willis. I'm age 31. I was diagnosed 17 September 2009 with ALL. I'm here today to inform you of the need for bone marrow donation and how you can help to save a life. Here's my story. I'm a single mother with two beautiful children, Trent, 11, and Haley, 8. I'm a daughter, and I'm a little sister. I'm an active duty Army combat medic. I'm an OIF 5 veteran. I'm a friend, and I'm a loved one. I'm a college student. I'm a cancer patient with a poor prognosis, and I'm waiting for a bone marrow transplant. What is leukemia and understanding ALL? Acute lymphocytic leukemia, or ALL, is a type of blood cancer. Other names for ALL are acute lymphoblastic leukemia and acute lymphoid leukemia. About 5,430 people in the United States are expected to be diagnosed with ALL in 2008. It was the most common type of leukemia for children under the age of 15. The risk of getting ALL increases in people ages 45 and older. However, much like me, you can get ALL at any age. Most children with ALL are cured of their disease after their treatment. New cases. An estimated 245,225 people in the United States are living or are in remission from leukemia. An estimated 44,790 new cases of leukemia will be diagnosed in the United States in 2009. Chronic leukemia accounts for 11% more cases than acute leukemia. Most cases occur in older adults. The median patient age for diagnosis is 66 years old. Leukemia is expected to strike more than 10 times as many adults as children in 2009 alone. About 44,790 adults in comparison to 3,509 children aged 0 to 14. About 33% of cancers in children aged 0 to 14 are leukemia. The most common cancer in children 1 to 7 is acute lymphocytic leukemia, ALL, which I was diagnosed with. The most common type of leukemia in children is acute lymphocytic leukemia, which accounts for about 5,760 new cases just this year. I don't fit into any of these categories because I am a special case. The causes and the risk factors. ALL starts with a change to the single cell in the bone marrow. Scientists are studying the exact genetic changes that cause a normal cell to become an ALL cell. Few factors have been associated with the increased risk of developing ALL. Exposure to high doses of radiation therapy used to treat other types of cancers are known as a risk factor. Other possible risk factors are continually under study. ALL is not contagious or catching. ALL occurs at different rates in different geographic areas. There are higher rates in developed countries and in socioeconomic groups. Scientists continue to explore possible relationships with lifestyle or environmental factors, but no firm conclusions have yet been reached. This suggests that many factors may be involved. At the present time, there's no known way to prevent most cases of this disease. Some signs and symptoms of ALL are similar to the other more common, less severe illnesses. Some blood tests and bone marrow tests are needed to make the diagnosis. A person with ALL may have aches in their arms, legs, back, black and blue marks for no apparent reason, enlarged lymph nodes, fever without obvious cause, headaches, pale-looking skin, pin-sized red spots under their skin, prolonged bleeding from minor cuts, shortness of breath during physical activity, tiredness, vomiting. The best advice for any person troubled by symptoms such as that are long-lasting, low-grade fever, unexplained weight loss, tiredness, shortness of breath is to see a healthcare provider. In my case, I was perfectly healthy, ran 4 miles the morning that I was diagnosed, did survival training in a pool in full gear, and simply got a headache and a fever and was diagnosed in ICU that night. The treatments. Blood and bone marrow tests are done to look for leukemia cells. A CBC, or a complete blood count, is used to help diagnose ALL. A bone marrow aspirate or a bone marrow biopsy are 2 different tests that are done. An aspirate is done to take a close look at the cells in the marrow in order to look for abnormal cells, or as they call them, blasts. The biopsy gives information about how much disease is in the marrow. The doctor uses information from these tests to decide the type of drug therapy that a patient needs and how long treatment will last. Bone marrow tests are done to see if treatment has destroyed the leukemic blast cells. To decide the best treatment for the patient, the doctor may consider the patient's age, the number of ALL cells in the blood, if the ALL has spread to cover the brain and spinal cord, and if there are certain chromosomal changes. In my case, I had all 3. Some patients have a remission after treatment, but the ALL cells return. This is called relapse. Other patients with ALL may still have ALL cells in their marrow even after treatment. This is called refractory leukemia. Mine involved 3 relapses, turned into refractory, and now I'm back into remission, ready for a bone marrow transplant. For patients who relapse, the same or different drugs may be given or be used. A drug called clofarabine is used to treat children ages 1 through 21 and relapsed with refractory ALL. In refractory leukemia, drugs that were not used to treat the patient's ALL in the first round of treatment may be given. Allogenic stem cell transplants may also be used. And this is where I fit in. Clone wars and stem cells, bone marrow transplant, the final frontier. Stem cell and bone marrow transplant. The cells used in transplant can come from 3 sources. You have marrow, peripheral blood, and the blood in the umbilical cord of after a baby's birth. Since blood and marrow are both good sources of stem cells for transplant, the term stem cell transplantation has replaced bone marrow transplantation as the general term for procedure. The acronym BMT is now used to represent blood and marrow transplant. Collecting stem cells from marrow is a surgical procedure. Peripheral blood is the most common source of stem cells for transplant. For many patients like me, this is the final hope for survival. How to save a life and to donate. Thousands of patients hope for a bone marrow donor who can make their life-saving transplant possible. They depend on people like you. You have the power to save a life. Take the first step today. The resources you can go on are www.marrow.org, www.marrow.org, help donate cord blood, and www.leukemia.org. Be a hero, save a life, become a bone marrow or a cord blood donor today. Thank you.